Okay, let me show you two cases prior to asking you questions. So this is a case of a 72 years old female. She's pseudophakic because she received a cornea transplant with a corneal decompensation with a reduced visual acuity, and she has contracted keratitis at the periphery of the flap from streptococcus. And so she has made culture, and so this was the result. But she's also received treatment and based on the antibiotic resistance test that I will show you. The second case has to do with a 55 years old female. She is a soft contact lens wearer. She had a 4.5 visual defect, and then she had a protozoa and acanthamoeba in particular. And so the first question which I would like to ask you is what can we do? So what sort of treatment would you resort to for these two different types of patients? Okay, let's begin with the voting. Is anybody there in the audience who would like to cast a vote? Insieme?
Absolutely the same. It's
Cast a vote. Cast your vote. Being two different pathologies was a sort of a provocative statement. First of all, I wanted to know your opinion about it, and then I didn't want to get into the details of the therapeutic indications for the cross-linking. Okay. The finding? No, the results, sorry. Okay. Obviously, it's the procedure that we consider to be the most adequate one. But I would like to now reason about the reasons why. So the motivations, why should such a procedure plus antibiotics be the best way to go? To this date, even in the meta-analysis that you see on the slide, cross-linking is considered as a treatment that is supplemental in a sense, or acts together with the antibiotic treatment aimed at strengthening the anatomy we are faced with, in addition to resolve the disease itself. Why resolution of the disease? Because there is an antimicrobic effect we know about, where this toxicity threshold at the cell as well as the pathogen levels is reduced by 10 times thanks to cross-linking. Also due to the anti-radical effects caused by the cross-linking treatment. So there is a considerable strengthening of the stroma, which means greater resistance to the enzymatic digestions by the pathogens and the polymorphonucleate cells, and so repopulation of the stroma itself. Since increasingly we talk about different treatments for cross-linking. When we talk about corneal ectasia, we should also talk about the indications for such a protocol. So I, on purpose and based on the results or the findings to be found in the literature, I have made reference to the fluence of 5.4 joule per square centimeter. So this decision, of course, would entail the resort or the permission and the authorization of an ethical committee.
Qualcuno sta votando?
Is anybody voting? There is
Or you would like to use, or you would choose.
Eccolo.
Okay.
Here we are. Here again, the procedure, this is the adequate procedure for two reasons. First of all, because although the new cross-linking agents that we have today make it easier and easier to customize the procedure in time, over time, the idea is that the longer, sorry, says the speaker, I have a considerable difficulty with the slide. However, the longer the radiation time, the higher the number of replication cycles of the pathogens involved. And this is because each pathogenic agent, from bacteria to protozoa and all the rest, have a replication time which depends on the temperature of the culture medium, on the culture medium itself, and also the reactions of the pathogens. So we cannot generalize because the longer treatment time, however, has also an effect on the replication cycle. So, okay, the correct answer is in millibar. And if we consider the agents we have at our disposal today, but the new instruments also allow us to reduce this time and therefore to make the treatment even more effective. Let me remind you that these patients have been treated with the window absorption procedure, so we can whereby we can use osmolar riboflavin, and we can induce corneal swelling of the stroma through the ulcer itself. Then riboflavin, of course, is distributed through the window also to the surrounding areas. Of course, we shouldn't forget to act under the necessary conditions in terms of absorption spectrum, because otherwise its efficacy might be reduced, as it happens with the fluoroquinolones. But the real focus of my presentation is to reason about the terms treatment success and treatment failure. Here we have four possible answers to the treatment that we have been voted about. First of all, I don't want to influence your vote, but this is the underlying theme. That is to say, we have to consider whether what we mean by healing or cure, because if healing is only the absence of pathogens or something else, but let me wait for the votes to be cast.
Oh, here we go.
Sì.
Here we are. So the purpose is exactly this one. We should forget considering as healed all patients in exactly the same way, because when we have an infection that may lead to a significant loss of tissue, thinning, or a situation as the one that I am trying to show you, and so I need the slide that I see on my screen, my PC. Okay, that's it. That's the correct one. Okay, we are talking about far from homogeneous situation. Here we have epithelial hypertrophy, but here there is a risk of ectasia. And so here, however, the patient was healed and there is no infection ongoing any longer. But the situation certainly is not the ideal one. Look at the follow-up of the patients that I have shown you at the beginning. This is the beginning of the treatment, and then you can see a demarcation line. And so we can see here the acanthamoeba situation where the transparency has been restored, and the fibers being very compact means that the anatomy is certainly much safer. So to get a visual recovery, of course, also the regularity is necessary. But once this situation has been resolved, we can, through photokeratectomy surgery, we can induce a regularity that can lead us to a considerable visual outcome. So why acanthamoeba at the beginning? Because, you know, on fungus, the literature is quite varied. So we have recently published, but we shouldn't forget that when it comes to the combination of different treatments, the effect on in preserving the stroma conditions can be very important in relation to with this treatment, and this has to be